Kellyanne Conway, counselor to President Trump, joins me now live. Boy, there's a lot of news to get to today, and the White House is right in the middle of it. Let's start with where we are with this stimulus bill and kind of where you think it needs shoring up, because seeing those unemployment numbers now, Kellyanne, maybe we'll need more.
Harris, thanks for having me. And I just left a call that the president and vice president are having with our nation's governors. I came off that call to come out here, and I will tell you on that call, Secretary Mnuchin reported to the governors precisely what is in this stimulus package for them. And he reviewed the fact that we have over $100 billion in direct support to our hospitals, our first responders, our healthcare workers. In addition, about $27 billion for life-saving vaccines and replenishing our critical supply chain. He also was talking about the $370 billion plus for small business owners. And I just want to read this to you because it's pretty impressive to hear 2 months worth of your employees' salaries, so long as you keep those employees. You can't just kick them off the payroll and fire people and use the money for other purposes. So there are guarantees in there. It's also meant to help with child care needs of those healthcare workers, first responders, sanitation workers who can't not show up to work, who can't telework. Harris, we need them on the front lines, and God bless each and every one of them. So we want to help them with their child care needs as well.
Amen.
Now, today you had very tough unemployment numbers. These are shocking but not surprising. Everybody warned us that it would be this bad, and I think extraordinary, unprecedented times yield unprecedented numbers like this, but it also yields extraordinary, unprecedented measures like this stimulus. Let me just give you a good news. We have a number of American companies creating jobs.
Because I want the audience, forgive me, and I know there's a little bit of delay, but we worked together on this. What's on the screen for our viewers right now, we're going to hit that number so people can see what it is. So the jobless claims are hit a record, so we're past a record, 3.28 million, up from 282,000 the previous week. Now, of course, we've been in record territory on how low it's been recently, so that is a change. But I just want to jump in there and say this. It also shattered the Great Recession of 2008 peak of 665,000 and the all-time high peak of 695,000 in a week set back in October of '82. I understand the amount that's in there now. Some governors are saying in their states the money for them won't be enough. But when you see these numbers, you want people to keep people on the payroll. This may not be enough. Is there a phase 4 coming?
There very well could be. Actually, the president just broached that in response to a very specific question he got from one of the state leaders. And I'm sure the White House will put out a readout. This is the third of 3 in very quick succession packages coming out in a bicameral, bipartisan way. If this reaches the president's desk tomorrow, Harris, as we expect it will, he will sign it. And then the implementation begins. Secretary Mnuchin has said within the next 3 weeks, people can see that direct deposit or checks if you don't have direct deposit. $1,200 per person for a family of 4 with 2 school-aged children. That's $3,400. We recognize that as this goes on, that may not be enough, but we stand ready to continue giving that relief to American workers, individuals and industries that are in specific distress. And let me say, this is really just a continuation of the pro-American worker agenda that the president has put forward from the beginning. And we want to continue to make sure that people know this. This is a medical crisis, not a financial crisis, first and foremost, which is why the president says we're going to turn back on the American economy, but after we follow the facts and the data. But Harris, I just did want to quickly just mention a few of the places that are. I'm sorry, there must be a delay.
Let me jump in one more time because I want to segue from what you said, because you set this up perfectly. You said this is a medical emergency. And boy, I got to tell you, Kellyanne, it's looking pretty dire in some parts of the country, not every part. Hospitals across America are facing a crisis with shortages of equipment and protective gear. We're hearing directly from the people on the front lines. So no politics here. We're talking with those people at the hospitals. 13 patients at a New York City hospital have died of coronavirus at one hospital, Kellyanne, in one day. And all of the city's 1,800 intensive care beds reportedly expected to be full by tomorrow, by Friday, headed into the weekend. We had a doctor on last hour, Dr. McCary on Outnumbered, Kellyanne, who said that they are splitting ventilators. I'm going to drill down with doctors later this hour to see what that means and can they be repurposed and what that does with such high contagion. But all of this speaks to what you were talking about. This is a medical emergency. How does the president meet that and also face the headwind of what's coming in the economy?
We've been working around the clock, and when I say we, beginning with the president, the vice president, the task force, obviously FEMA is very heavily involved now, running the response as FEMA does. And I just heard Administrator Pete Gaynor tell the nation's governors and mayors and territory and tribal leaders that FEMA is there, but first your local counties and cities have to go to the state first because we're dealing with the states. And then you go to your 10 FEMA regional administrators to answer your questions. They are surging supplies. In fact, he made clear that we are acquiring supplies overseas. We're acquiring supplies from state to state, and that we do want our anesthesiologists, our critical care medicine, our clinics, everyone in hospitals to take account of maybe what they do have so we can have a piece of information, better data about what exists. In the last 2 days alone, 4,400 ventilators have been sent by FEMA to the state of New York. We know that the governor there has said he needs more and more, as do other states. We are trying to go to the places most in need, where we see those clusters that are there and growing. I do think it's very disappointing that the mayor of New York City himself was riding the subway on March 5th and telling people to go out in the town on March 2nd. Kellyanne, I'm going to stop you on the
politics.
Well, it's not politics. It's that we have a very dire situation in New York City. That is not politics. I think it was politics to say go out in the town.
We do have a dire situation. We do have a dire situation.
But that's why look, I think this unanimously passed in the Senate is the point. It's bipartisan. Frankly, it's nonpartisan, Harris. We haven't talked about politics here in a very long time at the White House. This is nonpartisan. People are suffering, which is why this is 100%. The third of three. This is the third of three economic relief packages that this president is signing to give that direct relief. And I'm very happy that the Congress and the Senate have come together in a bipartisan, bicameral way to do what? In addition to everything else in this package, over $100 billion in direct relief to those hospitals and healthcare workers. They are the heroes. They're out in the front line, and they can't telework. They can't take a day off. They're there overtime. We want to make sure
100%.
that they've got the personal protective equipment. I was happy to see, well, more relieved, I should say, to see the governor of New York today say in his press conference that they have PPE immediate needs. They have it for the immediate term. So as, again, we take those inventories and we surge our supplies, we are working overtime to do that.
All right, real quickly, is there a discussion in the White House today with the president about that Easter date, as we now haven't even, doctors are saying, haven't yet hit the apex in some of these hard-hit areas by COVID-19? And Kellyanne, I know you lived on the East Coast up north by me in Jersey. People have left New York City.
Yes.
They have left and fanned out, which means they're potentially taking it with them. So which sectors do you open? I'm curious about that date, and then I'll let you go.
Sure. Let me say a few things. First of all, this is why the White House and Dr. Debbie Birx, who's coordinating the coronavirus response here for the White House, this is why, Harris, she said, if you were in New York in the last 14 days and you left there, you should self-quarantine or self-isolate, whatever her medical term was. And she's saying that to the people who are out in their houses in the Hamptons, up in Connecticut, down in Florida, wherever you've gone. The point is that you may be a carrier and not know it as the seed spreads. So she was on top of that immediately. To answer your other question, and this is why I mentioned sort of New York City, because I think you have a lot of commuters from Bergen and Essex County, New Jersey, from Connecticut, from Pennsylvania, who are going in and out of New York City before they went on virtual lockdown, who didn't know this. And that is why it was unfortunate that there were mixed messages there, while other places like California were locking down.
That's a good point.
Yeah, no, it's true. And you do see, I just heard Governor Murphy of New Jersey say it on the governor's call, and New Jersey, as of today, has an emergency disaster declaration in place. That was approved. I think it's the 9th state, Harris. And New Jersey is really seeing a surge in cases overnight, over 50 or 60%, as I understand it. And a lot of those are the commuters in and out of Manhattan. To answer your question about Easter, the president is telling America that this economy will have the great American comeback. The economy will be turned back on. He used Easter as an example, but then he came back in the press conference and said, listen, this is a medical crisis, not a financial crisis, and I just want to make sure people know this won't last forever. And he said, we will follow the science and data.
Sounds
and it
like
won't
he's flexible.
Well, it won't be an immediate spigot. He said he's going to follow the data and the facts. He's listening to his health professionals.
Got it.
Dr. Birx, Dr. Fauci, Admiral Jawar, they're here every day working around the clock with us, and they've done a great job. But I think also the economic relief that's there today for people is important also, so they see the government is helping them.
Kellyanne, thank you so very much for your
Thank you,
time,
Harris.
and
Stay
thanks for
safe.
getting into the
Yes.
nitty-gritty, because I know you know this corridor well and how things spread and all that detail. Appreciate it. Thank you.